Cook County Health Managed Care Committee meeting. Roll call.
Director Harrington. Present. Director Masuda Barnett is absent. Director Staines. Here. Director Webster Cross. Here. And Chair Lowry.
I am present.
You have a quorum.
Thank you. Any additions to the agenda?
No, sir.
Public speakers?
No, sir.
I will now entertain a motion to accept the minutes of the Managed Care Committee meeting held on October 17, 2025.
So moved.
Is there a second?
Second.
Any discussion? Hearing none, seeing none. All those in favor say aye.
Aye.
All opposed? In the opinion of the chair, the ayes have it. We will now hear a report from Health Plan Services presented by Aaron Galiner, Chief Administrative Officer of Health Plan Services. Aaron.
Thank you, Chair. Good afternoon, directors. We will begin with some of our standard metrics today and then go through some review of our successes from the last year as a bit of a retrospective, and then provide some context on what our priorities are as we head into 2026. With that, starting with current membership, we are at a total of about 387,000 members. This is a slight decrease from the prior month. We have continued to see enrollment decline more broadly in Medicaid, which is something I'll talk about here in the next slide. So this shows two of the key factors that underlie our membership trends. So the retention rate, the number of individuals that are successfully completing redetermination, as well as the percent of Cook County Choice enrollment members. So this is the number of individuals that, when they come into Medicaid and make a choice of a health plan, are choosing County Care. We're really excited that that choice rate is hanging around the 33 to 34% mark. Looking back about 2 years, that was at around 20%. So we've made a lot of strides in terms of improving the member experience, which we're going to talk a bit about. That's really helped to drive up that choice rate within the health plan. Redetermination rates continue to be a focus for us. I think the 88–89% mark has been a pretty stable range for us. Obviously, we've continued to build on a lot of the infrastructure we've put in place during the Great Unwinding to help individuals through this process of redetermination, and that's going to serve us well as we look forward with the Medicaid changes that are coming from the federal policy perspective in the future.
And Aaron, we're looking at redetermination now every 6 months?
That's correct. For the ACA adult population, that'll move to every 6 months in 2027.
And what do you think you can get that rate to?
Well, I
that
think...
that seems pretty reasonable, but so you think there's much upward space on it?
Yeah, I think we've, and Chrissy, feel free to chime in on this too, but I think we've sort of seen this stabilize. We've ranged at the highest, maybe in the 91% range is sort of the kind of maximum. There is just an underlying number of individuals that lose eligibility for different reasons. So I think we're at a reasonable range. There's probably some opportunities for that to go a little higher, but I would say we're pretty close to that sort of stable peak. All right, the next slide shows our current market share data. We've continued to see our market share increase month over month. We're now at 34.9%. This data is through November, which is the latest published from the state of Illinois. For some context here, we hit our high watermark on market share right at 35.0% previously. That was the month before the state made the change to the HBIA eligibility, and because County Care had the most, almost all of those members in our plan, we saw our market share decrease when their coverage was terminated. But since that point in time, we've continued to gain market share, so we're now almost all the way back to that 35% mark, which is great. The other call outs I would make on the slide is Blue Cross has also ticked up just slightly from 28.3% to now 28.4%. And the rest of the most of our growth and that slight increase from Blue Cross has come at the expense of the other health plans. The next slide shows you the trends that are sort of underlying those market share dynamics. So the red line on the right-hand side is total Medicaid enrollment in Cook County. That has continued to decline month over month. And really, if we take a step back now, that Medicaid enrollment is down more than 100,000 members over the past 12 months. So a fairly substantial decrease on a base of about 1.2 million members in Cook County. County Care is on the left-hand side. You can see our trend has been, with the exception of that one period where we lost HBIA coverage has been much more, a little flatter. We have continued to see membership decrease, but at a slower rate than the overall decline in the market, and that's what's causing us to gain market share. So we're doing a little better job than the other MCOs in terms of gaining new members that are coming into Medicaid, as well as retaining members as they go through that redetermination process. The next slide shows our fiscal year 26 budget. We are starting out slightly ahead of budget. The red bars here show what we are projecting. As you can see, we are continuing to assume that enrollment decline is going to continue in alignment with the broader market dynamics. We are starting out slightly ahead of budget. Thankfully, we outperformed slightly towards the end of last year in terms of, again, our retention rates and our choice rates, which has helped us at least start the year in a pretty strong position. Of course, there'll be some more dynamics throughout the course of this year. We're anxiously awaiting the governor's budget address to hear if there's any changes that are potentially going to happen to the HBIS program, where we have about 3,000 members. In addition, in October, we know that there is a subset of legal immigrants who will lose Medicaid coverage as well, which we expect to impact about 2,200 members, which we'll comment on more as we talk about some of the federal policy changes. Then finally, for our metrics, I wanted to share our claims payment slide. I think I mentioned this before, but at the end of last year, as we hit our appropriation limit within the county budget, we hit this period where we had to slow down claims payments, which caused a significant increase in our aging of claims right at the end of the county budget year. As that budget's now rolled over, we've been accelerating claims payments back out to providers, and so that's started to come back down. We still have some more work to do, but as of right now, we're averaging around 42 to 43 days in terms of our turnaround times to payments. We need to get that back down to the 30-day mark as the standard and the requirement, but this continues to be an area of emphasis for us right now. All right, switching gears, we wanted to provide some context for significant wins for the health plan in 2025. I know you all have seen this before, but we like to talk about it. So we'll share it again that we hit the 4-star rating for NC2A. This is the standard way that health plans are measured in terms of quality nationally. We, of the Medicaid MCOs in Illinois, had the highest rating at 4 stars. Next closest was 3.5 stars. And that also put us in the top 22% of health plans nationally for our quality scores. The next slide shows a summary, which I won't read off each individual item for you here, but I think a few call-outs I would make is that over the course of 2025, we put a lot of emphasis on our member experience work, as well as how we really outreach and engage with members. That's really the beginning point for all the other work we do in terms of being able to close care gaps, get them connected to care, be able to address issues that they're having. So we did a number of different initiatives that were focused on that. So for example, we launched a new outbound call center that we've seen much better success rates in terms of how we outreach and engage with members through that call center that's actually managed by Lighthouse here locally. We've also built a new text messaging vendor that we brought online. We've redesigned websites and provider portals, member portals. So there's been a lot of sort of underlying work that's gone into really redesigning that member experience across the board. We've also continued in a number of areas, including value-based care, to continue our focus on expanding in that area, both to create more incentives and more aligned structures with our providers in terms of how they care for our members, but also to be able to limit some of the risks that the health plan takes on as well. And then I think one of the real highlights for us was that our CAHPS rating, CAHPS is the main survey assessment that members get to provide feedback on their experience with the health plan. We hit the 5-star level for members' rating of a health plan, which puts us north of the 90th percentile for member experience, which we're very proud of. With that, I'm going to hand it over to Chrissy Torino, our Chief Operating Officer, to go into a deeper dive of some of those changes we made around the member experience specifically.
And before we hear from you, Christy, Madam Secretary, if you could add Director Masuda Barnett to the roll.
Done.
Thank you. Christy.
Thank you so much. Good afternoon. Thank you so much for hearing from us on our member experience journey. So we'll continue going down this retrospective on the work that we did starting in 2024 and 2025. I want to share that all of these changes that we made were really based on feedback that we received from our members. As Erin mentioned, we conduct our CAP survey on an annual basis, and that's how we receive that 5-star rating for the rating of a health plan measure. That's kind of the key measure that we look to understand whether our members are really satisfied with us as a health plan. But we also do focus groups, enrollee advisory councils, ongoing surveys to get members' feedback throughout the year and then make adjustments based on that. So we'll go into a little bit more detail on these. But based on our members' feedback, as Erin mentioned, we launched a new provider directory in September of 2024. We also launched a new outbound outreach team. We partnered with a new text vendor, which really offered the opportunity for us to revise all of our messaging out to our members. We launched a new member portal and website, and then have done ongoing outreach and redetermination events and ongoing contracting with new providers, and we've really had a focus on language access to make sure that our members are getting services in their preferred language. So if you go to the next slide.
Is there an app, or is it just a website?
So we have a website. We don't have a member app for county care, but we do have a member app for our transportation. So members can basically use an application where they can track their rides for pickup, much like Uber or Lyft. We also have an application for our rewards program because that's been another area of engagement with our members. On the next slide. So, and I will mention that through all of these enhancements, we really did have an emphasis of making sure that our website, our provider directory, were very mobile friendly. And so that was another kind of opportunity from a user experience perspective, and did user experience testing with our members at redetermination events and at our enrollee advisory councils. So we launched our new provider directory. We continue to improve the underlying data displayed in the provider directory, improving our functionality, including members being able to search by body part, by symptom, provider type, and specialty, and then are working ongoing to make sure that that information underlying in the provider directory is improved. If you go to the next slide. We, as Erin mentioned, we also launched this outbound call center. So our call center, in partnership with Chicago Lighthouse, does outreach for welcome calls. We do health risk screenings. We also help people schedule appointments directly with medical homes, with specialists, and those really were with the goal of improving our getting needed care and getting care quickly measures. Between February, when we launched the new outbound call center, in December, we had about 49,000 completed interactions with our members. So we just saw a huge amount of increased engagement, which was really the goal of this partnership. And if you go to the next slide. We also launched a new text vendor. This occurred in April of 2025. And in 2025, we texted our members a lot. We texted over 9.5 million text messages, but we only had a very low opt-out rate. So of only about 9,000 folks decided that they didn't want to receive text messages from us. And we took this as an opportunity to look at all of our messaging with our members, because we have so much engagement and because members say this is how they really want to interact with us. And so we translated our text messages into 5 additional languages in addition to English, and then also made some improvements to all of our campaigns, but also our health risk screening and survey.
Do we have data in terms of text by generation? There's some people that use their cell phones a lot more than others.
Yeah, that's a fair point. We are able to show text messages by our membership. We have, as you can imagine, a very large family and children population, and then adult ACA population. So those are the majority of our members that receive text messages, as they're about 3/4 of our overall membership.
What are like the overarching goals of the text message campaign? Like, is it to ensure they're accessing care, or I see like the reward system?
Yeah.
Yeah.
That's a good question. So all of our text messages are targeted to that individual member. We have a member journey where when they come onto the health plan, we send them certain text messages and ask them questions like, what are you interested in learning more about? And that really determines what kinds of information that we share with them. If they say, which, as you can imagine, probably one of the areas that people are most interested in is our rewards program. If they say we're interested in rewards, we then will send out those messages, and always our rewards messaging is in alignment with someone getting a care gap completed. So it's tailored to that member. If they need to go see their primary care provider, we'll send that text message out to them. And then they, of course, have the option to opt out at any given time. But the primary goals are to remove barriers to having information about the health plan, of course, but then also targeted messaging around care gaps and really improving quality and outcomes.
And is the vendor then giving you data associated into that so that you know you're kind of meeting the goals?
So we often look at our who we're messaging in conjunction with our HEDIS outcomes, so our quality outcomes. That's really, of course, like we're probably having lots of different kinds of touch points, but we found that that's been kind of the best strategy, is making sure that, because there's some people who want to be texted, there's some people who may want to receive a phone call, and they may receive some different outreaches from the health plan, and so there is a little bit of overlap there, so it's not always super straightforward in correlation, but we do look at our outcomes by whether we text them and the different kinds of outreaches that we do to the member.
Great, thank you.
All right. So we also launched our new member portal. This went live in July of 2025. Since that time, we have had just over 22,000 members who've registered for the portal, and we wanted to make sure that it was really streamlined from a member experience perspective. So your question around whether we have applications, there is single sign-on from our member portal to our Mode of Care, which is our transportation application, as well as our rewards application on the portal. Members can also click and get a visit to virtual care through Cook County Health as well.
So I'm assuming you're showing us because the numbers have gone up, because we don't have a contrast. So what was it before, maybe last year? Has there been an increase? Are there more people using it?
Yeah, I'm happy to share. So from the time that we launched our last portal in 2014, we had 60,000 total users between 2014 and 2025 when we launched this portal.
That's a unique number?
Of unique members who had registered on the portal. So 60,000 over the period of almost 10 years. And since that time, so since July of this last year, we've had 22,000, or a third of that membership sign on. So we're hoping that that's because it's a much better experience. So we expect to see this increase to rise, and we have actually been seeing that month over month. All right, if you go to the next slide. So we refreshed our county care website, and the goal of this was to make it much more member-friendly, mobile-friendly. On the table at the bottom, you can see our overall website views increased about 41% between 2024 and 2025 when we launched the new website. We also saw a huge increase in homepage views, and then an increase in total homepage users as well of about 35,000 users. And if you go to the next slide, lastly, I'll share kind of I know we've shared this quarter over quarter, but are very proud of our redetermination events. And another important way that we engage with the community is being out in the community. So we have these events almost 5 days a week, and had just over 230 events in 2025. We had a county care member of attendance of about just over 6,000 members, just over 6,800 members, and a total attendance of just over 11,500 members. So as you can see, we're serving not just county care members, but the broader Cook County community, and ensuring that people keep their Medicaid benefits, and that'll definitely continue to be a way that we engage with our membership. All right. So on to growth and transformation, we won 2 NACO awards, 2 awards from the National Association of Counties, one for eliminating lead for drinking water for Illinois families in Medicaid. We sent out a communication to about just under 90,000 county care families, and made it so that they could redeem a coupon for a water pitcher and filter that they, and we had about 8,000 members redeem that. We also received an award for providing health benefits for the immigrant adults and immigrant seniors population in Cook County in that implementation. We are also proud to have won quite a few marketing awards for our Bring on the Benefits campaign. We won a gold award for multilingual advertising, and then quite a few silver awards as well. And then, as you've probably seen, our new campaign is out in the community, and we'll share a little bit more about that in just a minute. So that's our health plan built around you. We conducted 6 focus groups with about 38 participants, representing members across the health plan in English and Spanish. And they selected this campaign, and it really resonated with them. We'll be bringing some additional metrics, probably with the leadership of our Chief Communications Officer, Alex Normington, to share out at a future managed care committee on the results of this campaign. So now I'll shift gears just a little bit. We responded in November to the Health Choice Illinois request for proposal. So this was the RFP where the state is selecting health plans for the contract year 2027 and beyond. The RFP was released in September. We responded on November 12th. And on the next page, next slide, you can see what we were able to accomplish within that couple month time frame. So we wrote a 340-page technical proposal all about the work that the health plan has done, but also what we plan to do in the next contract year around population health, clinical services, making improvements to our network, and really our strengths in value-based care. And then we also submitted about 1,200 pages of commitment to diversity documentation, demonstrating all of the work that County Care has done in diversity, equity, and inclusion in the community, as well as our staff diversity and our commitment to the Business Enterprise Program and our Business Enterprise Program Utilization Plan. So what comes next? So we are anxiously awaiting the response from the state, and they are supposed to come out with a decision sometime in February, so this month. The contracts are to be executed in July of 2026, and then the new operational start dates. The new contracts will be going into effect, of course, in July, but then the operational start date for where we will be under the new contract will be January 1st of 2027. So the contract terms for the new contract is an initial term, as I mentioned, of July 1st. But then there will be the option to renew after the term date of December 31st for an additional 5.5 years. All right, so going into policy updates, are any questions about growth and transformation before I continue?
So are there some changes in the contract that you're really hoping to get from the state?
So they actually issue the contract at the time of RFP, so we're able to see everything that's in the new model contract. Of course, they have the opportunity to make some changes before execution, They're kind of the key components that are really going to be shifting is a new focus on condition management and disease management programs. So we are evaluating those closely and anxiously and excited to implement those for the health plan.
And what about the for people who don't choose an option, any chance that they're gonna up the percentage that they're, placing into county care?
So we've traditionally
I
had,
know our high quality should get us there, right?
I would think so too. We've traditionally had a really high auto enrollment rate within the state of about 50%. And so within the contract, it did not lay out any more clarity as to how they would be making determinations for auto enrollment. So we'll be, looking to see whether there's any shift at the new contract timeframe, partially just because there will also be the opportunity for, of course, different health plans in the market. Okay. So going back just one slide, there were some changes to the SNAP program as a part of what is called the One Big Beautiful Bill Act, or HR1, and that included the inclusion of work requirements starting February 1st of 2026. We've been working really closely with our teams and in partnership with the Greater Chicago Food Depository to make sure that our county care staff are aware of these changes to be able to support our members with coming into compliance with those work requirements. And we have a lot of additional information here around what occurred at the end of last year related to the federal shutdown and the impact that it had on SNAP benefits. But Illinois really acted quickly and issued partial benefits on November 6th. And now, due to a continuing resolution, SNAP is now fully funded through September of 2026. You go to the next slide.
I have a question before we move forward. When you look at the looming work requirements, both for SNAP and Medicaid, do we have a plan, a partnership plan? How are we looking to really address this change? And I ask that because I'm being asked by other partners, such as the Chicago Cook Workforce, et cetera. So what's our overall plan? Do we have one?
Yeah, I'm happy to start, and Erin, feel free to chime in as well. So we are partnering with, Cook County Health has really been convening this impact work group, Medicaid impact work group, that has several subcommittees and has been bringing together healthcare and family services, all of the managed care organizations, provider-based groups, as well as community organizations in several different areas, of course, just making sure that we're ready from a policy perspective and making those changes and supporting members, but then also from a communications perspective. So HFS has been sharing as much as they can around what guidance has been provided and come down from federal CMS. There's some additional guidance that will be coming this summer. So I'll be happy to share. We have a couple of additional slides here on kind of the requirements, and then also what we know to date coming down from CMS. And I'm happy to share kind of some of our plans there too. So if you go to the next slide. So and just as a little bit of background, so we have just over 100,000 members who are in the Affordable Care Act adult population that will be required to make some of these changes. So as Commissioner Lowry mentioned, mandatory work requirements, so they'll be required to have at least 80 hours for a month, and that will be the past month that they'll have to demonstrate for the Affordable Care Act, able-bodied population that are 19 to 64, as well as parents of children who are 14 and over, and then 6-month redetermination. Erin also mentioned some of the restrictions that are going into effect October 1st, which will be for folks with the definition of qualified alien, and County Care is estimating that's about 2,200 members that will be in that category who will lose coverage. So on the next slide, so we expect, there was a bulletin that came out on December 8th of 2025 from CMS. We expect that Healthcare and Family Services and Illinois will be implementing the option 1 that's listed here on the slide, which would be that our members would be notified from the state in September for those January members who are impacted by the more frequent redeterminations and or work requirements. So that is kind of I think, the most beneficial approach to our members. And we will be working in lockstep with the states to make sure that our members can get the communications that they need. We'll be texting our members in preparation for their redetermination, sending them other messages. We'll also be wherever we have data where we're able to, compliantly share that with our provider partners. We'll be doing that as well to make sure that they have those redetermination dates for people that have to take action. And then all of the outreach events and other channels that we've had already in place to support our membership. Yes.
While we're early in the process, at some point we'll have data to know what percentage of our patients are complying, and so that would be helpful information moving forward as things develop. What percentage we are at in terms of people that have complied and how many people are left. Absolutely.
Yeah, and we will likely have the data. So these changes are going into effect January of 2027. We'll have the data for the members who have been able to get, effectively through the redetermination process and additional work requirements closer to February of next year. But we're very happy to, at next Managed Care Committee, share some more about our strategy and some more specific information here, especially as we have more information come out.
Yeah, and where we stand and how we're looking.
Yes.
I think everybody's concerned about this.
Yeah, definitely.
Yeah, just to chime in here, I think to Chrissy's point, we're certainly early in the process. I think we're thinking about this in some phases. Right now, we are trying to push out a lot of educational information to individuals. The main call for them right now is to continue to update their information with the state so that when a lot of this guidance comes out and they have to renew their eligibility, that they're getting the right paperwork to complete that. And then obviously the next phase is going to be how we can best the system. Some of the key guidance that is still outstanding that we'll need, that states are waiting for from CMS is what are the guidelines of what managed care health plans can do versus what the state's required to do. So what restrictions we'll have. We know things like there's exemptions for individuals for this process if they're quote unquote medically fragile, but there's not set criteria yet of exactly what that's going to mean. But although I did hear there's some guidance that came out just the other day on that. And again, like who needs to make that determination? Can health plans submit information on behalf of the member to determine that? Does that solely have to be between the member and the state? All of those are sort of open questions. So as we get more and more of that guidance, we'll continue to lock in additional pieces of our strategy and additional ways that we'll work with individuals. In the meantime, though, certainly, Chair, back to your question, I think we are already thinking about community-based partnerships and ways that we can help support individuals with things like the opportunity to volunteer or workforce connections. So certainly we would love any connection with the workforce teams to bring in as part of that larger impact working group that CCH is leading.
Good, and I'll follow up on that. The other thing, we fully embrace that there are a number of open questions. To the extent possible, I think it'd be helpful to the directors as well as the commissioners just to have simple bullet points so that we have the right messaging. And it can be as simple as, we don't know, we're waiting for more state input and guidance. But these are the questions we're hearing on a daily basis in the community. So it'd be great if we had some, just some talking points as we go forward.
We're very happy to provide that. And I think also what the talking points are at any given moment, because to Erin's point, at this moment, the talking points are that there's really no changes to Medicaid currently, and they won't go into effect for the majority of these members until January 1st of 2027. And then to make sure that their information stays up to date, that they reach out to county care and reach out to the state to update their phone numbers and addresses, because that's the key way that they'll get the information and be able to do the redetermination and work requirements.
Great.
Yeah, I'm assuming there's a working definition of what constitutes work.
Yes, there are.
That would be helpful to know.
Yeah, and I think
That's
some
how
of
you
that,
measure it.
That's some of the guidance that's also coming out this summer, and so we're happy to provide any and additional clarity that we receive from the Centers for Medicare and Medicaid Services as that guidance comes down. Great, thank you so much. All right. So if no additional questions, you can go to the next slide, and I'll pass it over to our Chief Medical Officer, Dr. Audrey Tanksley.
Thank you, Chrissy, and thank you for having me today. I am excited to be here in this official role as the Chief Medical Officer. We met last time, but this time I'm actually assuming the position. So 2026 goals, our key objectives and key results is where I'm going to take us today. You can see here on this slide that we have aligned with the overall Cook County health system and have 4 strategic pillars that we are working within with our teams. And so these 4 pillars are listed here. 26 to 28 goals are also listed, so quality, safety, and experience. Our objective is to reduce health inequities through creating opportunities where our members live and access their care in the community. We are looking to obtain a 5-star health rating from the NCQA by 2028. We also, for our workforce pillar, we are looking at retaining and supporting our teams. We have amazing teams that are working for county care and for our members, and we really want to make sure that we support them and retain them in their professional development, as well as keeping them engaged and building a very productive workforce. We're looking to do this by achieving the 95th percentile of engaged employees on our employee engagement survey. For our fiscal resilience pillar, our objective is to sustain strong financial performance in the health plan services, and we're going to go through each one of these pillars individually as well. The key result is to achieve a $25 million annual margin by 2028. And for growth and transformation, we're looking at our innovation, our transformation. You've heard a lot about the things we did in 2025. We're looking to expand that and to really build upon that and to be the health plan of choice in Cook County and build upon those numbers as was asked earlier. And so our key result is to launch a new product by 2028. As always, equity is the foundation that each one of these pillars sits on. And so if you move on to the next slide, we'll go individually through a few of these. So looking at our member quality, safety, and experience, for the first, we talked over, we've kind of gone through this, reduce health inequities through creating the opportunities where members are. The key results for that are actually for 2026 to get to a 4.5-star rating. So overall, by 2028, we're looking to march to that 5-star rating, but taking it a bite at a time and looking at getting a 4.5-star rating, as well as to achieve the 90th percentile for our triple-weighted quality measures that we're already have an intense focus on, which are immunizations or chronic disease like diabetes and hypertension.
And one thing I'll call out as we go through these is these are fairly aggressive targets. And by way of example, there are no current 5-star Medicaid health plans in the country. So we are really setting these goals as sort of best possible outcomes. And, we've been on a quality journey for a while as a health plan. I think, we see this as a real opportunity for us to get there and to separate ourselves nationally. Getting to a 4.5-star would really put us in the top handful of health plans nationally. So, I will not comment too much on where we're at kind of currently based on our current data for this year. I think we're very confident that we'll at least maintain our 4-star rating, and I think we still see potentially a pathway to get to 4.5 stars over the course of this next year. But of course, thresholds change each year, and there's a lot of dynamics with that. But just want to give you a sense of sort of how we're setting these goals as we come back and sort of update you throughout the year against them.
So we should be halfway there in 2027?
That's the hope.
That's the hope. We're going to stretch. So just looking at our 2026 quality strategy, as Aaron mentioned a few of these, but I'm going to go a little bit more in detail. So the 4 buckets that we have here: preventative care, living with chronic conditions, behavioral health, and maternal child health. In the preventative care bucket, we already really engage our members and our providers in providing primary care access, but we're really going to enhance and make sure that that's top priority, as you heard with our text messaging and all of the other ways that we engage with our members. Our focus is on immunizations. We know there's a lot of misinformation and changing information in the country. And for us at County Care, but also in the state of Illinois, we know that immunizations are preventative and and we want to continue with the messaging of our Illinois Department of Public Health Director. We also are looking to implement scalable interventions to support our members. So we are implementing a population health service. We had an RFP for it, and we're actually implementing that population health service. So looking at ways that we're going to be doing in-home services and able to really capture that data in different ways than just a member going to a doctor's office. And as we mentioned before, our outbound call center is already live and very productive, and we're going to continue to have them focus on our care gaps to help with that preventative measure. Living with chronic conditions is really exciting for us. As Chrissy mentioned, the new RFP actually has a call out for condition management, and so we're really excited to build programming around this and to expand our disease management programming. The internist in me is just smiling that we get to look at chronic diseases. And so we're implementing our new population health program, and again, just really focusing on ways that our care managers are able to engage and help members live and have the best quality of life. Behavioral health, I guess the other hat that I wear, my addiction medicine doc inside of me is smiling for this one, because there's, as we all know, there is an increased focus and need on behavioral health. County Care itself has done a tremendous amount of work in this behavioral health space and has really kind of built a strong foundation, and so we're looking to just continue to enhance that by creating direct referral processes and enhancing our telehealth, enhancing our VBC, our value-based agreement, and really focusing on our high utilizers in the population and making sure that they're wrapped around with the care that they need. Our maternal child health program is also extremely strong and well-positioned to continue to grow. We're looking mostly at that early identification so that we can make sure, not only from a HEDIS metric, but also when we look at a public health, from that public health lens, that we're helping in our way that we're able to contribute to reducing mortality in that population. We're also looking to continue and increase our interventions, and really excited that we have added the new provider types in the state of Illinois. So our doulas and our lactation consultants are now a part of our network, and we're excited to enhance the work that they're able to do. One other thing that I'll say is really key for us as well too, we get a lot of data, but we are really increasing our supplemental data capture and working with our partner providers to be able to get more data that would help us to move the needle on the metrics that we're seeing. So you can move on to the next slide.
As you do that, let me just say, I love this. But I'm also mindful, we're mindful, that a number of the County Care members utilize Stroger and Provident and Bronzeville Health Center and other facilities we have. I think it's important when we look at preventative care, let's make sure we're also seeing if there's some symmetry between the screenings that we're now doing through my program and other programs. I mean, early detection is key, you guys.
Yes, it is.
And that's probably the best thing that we can really offer, now to a number of community members who historically have not gone to see a physician regularly. So I think that's important. The other thing, the telehealth piece is very important, and I know we're having conversations about specifically Provident and how that might look going forward, and telehealth is going to be a big part of that. So I just want to make sure that we're making sure all of us are talking and that we're incorporating, I think, some wonderful concepts throughout our entire system. And I think County Care is a key partner with that.
Thank you so much for those comments, and we actually are really, we are doing that. We're embracing our other county members and working collaboratively with them across various efforts. I've actually met with Providence regarding their crisis
Good.
center, and there's a number of projects that are underway with the Cook County Health System, care management, our pharmacy, our just
Wonderful.
any place we can integrate, we are definitely taking a hyper focus.
And a quick point of personal privilege, since I'm chairing this committee, I've known you for several years, and I'm thrilled you're a part of the team. Okay.
Thank you so much. I appreciate that. I am thrilled to be a part of the team as well. And I will say, just for the record, it has been the most warming and welcoming embrace that I've had. And so I am very, very humbled and appreciative to be in this role.
Great.
So I just want to tell a bit about our NCQA, because we are excited that we are going through our health plan reaccreditation this year that occurs every 3 years. And so this is our cycle. We're currently in our look back period. Our submission date is going to be in June of 2026. And our on-site survey is not listed here, but it's actually going to be in August. This year, we are also embarking on 2 additional accreditations. So we'll have our health equity accreditation, and this will be the first survey for that. Also, same submission period in June, and our long-term services and supports, or LTSS distinction, is a part of this, and this will be their first survey as well. Their submission date will be in June of 2026 as well. So looking forward to that. You can move on. So I'll talk a little bit about our workforce pillar.
Can I ask just one quick question? You
sorry
had said
about
at
that,
one
yeah.
point that you wanted to have a new product by 2028. What kind of a new product are you talking about?
Yeah, so I'm going to let Aaron take the lead on this one.
Thank you for that question. I think we've been evaluating a number of different opportunities. I think we've are trying to balance being thoughtful. So, for example, I think there's opportunities in different areas. Obviously, the environment today could make entry into some of those potentially challenging. So the exchange would be a great example of that. I think ultimately our focus will always be on underserved populations, and we want to have additional ways that we can service those individuals throughout kind of different points in their life where they may be transitioning between our Medicaid product as sort of our core product onto exchanges or into dual eligible Medicare, Medicaid coverage, for example. So that would really be the goal. I think the question of what makes the most sense in terms of that specific product we try to enter is something that we've been sort of evaluating continuously given the dynamics of the environment we're in.
Yep. Thanks. Helpful.
Thank you for that question, and thank you, Aaron. Are there any other questions before we move on to workforce? So just a couple quick slides here to talk about the workforce. Again, as I mentioned before, we are extremely proud of our workforce. We have a very strong team across the board, and we want to retain that team and to support them so that they are really getting all of that county has to offer. So our goal is to look at professional development of that team, and we're looking to increase our employee engagement survey. Again, this is a bit of a stretch because we know there's a lot of components that go into moving a composite score. However, our most recent composite score was 4.18, and we'd like to see that move towards 4.3. Move on.
It would be helpful and interesting to see the demographics of county care workforce.
Absolutely.
Who's worked for us, what positions.
I appreciate that comment. That's something we can bring back. Absolutely. So this is just about some of the ways that we engage our staff already. We have a very active staff engagement team, and that team actually does a number of activities, from educational activities to social activities. We have a monthly lunch and learn that is actually curated by Dr. Collins. We have a monthly midday mingle, and there's been a number of things. Actually, I started in October, and one of the first things I was able to join was the pumpkin painting, and it was a stress relief in the middle of a busy day. And so I think those are the types of ways that we'd like to really support our members, our staff, so that they feel appreciated. We also do things like professional headshots. We have newsletters to keep our communication going. We have focus groups with the county care leadership, especially with our CAO, Erin Galiner, but also with the larger county care leadership as well, in addition to department fairs, which is one of the things that I did not get a chance to participate in because it happened before I got here, but I'm excited for it this year because I heard it was a hit. It was one of those things that allowed all of the other staff to get a chance to see what the other departments do. And we talk so much about working in silos. This was one opportunity that our staff really enjoyed that allowed them to work together in a more horizontal fashion. Additionally, we had our annual holiday party, which I was able to attend, and it was extremely well attended by our staff, very engaging, lots of fun, and we got a little bit of work done there too. We also have volunteer opportunities. All of those RED events that Chrissy mentioned, so over 230 events, our staff volunteers for those. And are able to participate in those, in addition to a lot of fun activities that we do, like you see on this slide, of the Pride Parade, the Bud Billiken Parade, and many of those things as well.
Do you know what percentage of staff actually engage in these activities?
It's a great question. Did you know that?
Well, I would say for our annual holiday party, we had over 200 folks come out.
Out of what?
Out of just under 400. So we had a really large participation for our holiday party. For our headshots, that's something where we have about 20 folks who can participate, and happens every other month or so. So definitely all of these things are voluntary. We have a very active staff engagement committee, as Dr. Tanksley mentioned, but the purpose is to ensure that when folks want an opportunity to come together, especially as we've, are in a hybrid environment, that they have the opportunity to do so. But all of our staff are able to participate in, receiving ongoing communications. We have town halls every quarter as well. So we often will have, upwards of 350 folks participating on those town halls.
I'm curious if you're finding that there's different needs right now, given the external environment, particularly in terms of mental health, safety, and is Cook County Health more broadly doing anything, or are you all specifically thinking about that?
Yeah, Erin, do you want to take that, or do you want me to?
Go ahead.
Okay. So I will say that I've been very proud to be part of a health system that did send a communication out to our the broader Cook County Health team about the environment that we're in. I'm actually part of a fellowship program where women from across the nation asked each other if their hospitals were sending a communication, and I think we were the only ones that had done so. So that just shows what dedication we have to our teams and to really our mission. Beyond that, within our team, I will share that Erin actually, on our town hall, I think it was the week. Was that just last week? It was just last week. It was last Thursday. Kind of mentioned just to the staff how we understand that this is a very challenging environment to be in, and just how much we care for them, care for one another, and support one another, and to speak up if they need some additional support. So we're looking for different ways to make that message clear, and would welcome any additional feedback on that too.
Yeah, I would say generally, we definitely feel it. I think our staff broadly reflects the communities we serve, and we are a local provider-driven health plan, and so they're interacting with members every day that are, afraid of ICE, are concerned about the national environment, concerned about their Medicaid coverage. So I think our staff ultimately feel the weight of those challenges, and so we are definitely trying to be very thoughtful in how we speak to those issues and then what kind of supports we can offer. And certainly, CCH more broadly is definitely, I think, thinking about that in many of the same ways. So.
Have we ever done an employee satisfaction survey?
Yeah.
What's the most recent?
We're actually currently fielding one right now. It's closing today. We're at 63% response rate. So we're trying to get that up, but today's the last day of our employee engagement survey, and that's for county care specifically.
And I will call out just in regards to a couple of the comments that were made. So this staff engagement team is very, very attentive, and they listen. They have suggestion boxes. They go through. They read, and they try to make sure that they're taking the staff's comments into consideration when they're planning these events. As Chrissy mentioned, most of our staff is hybrid, and so it's not a lot of folks that are in the office every day. And so they are intentional about making sure that they actually hold these events on different days so they can engage different staff as well. So I think they're, within the context of, the restraints that we have, they really are trying to go above and beyond. And just for Mr. Harrington, that score that I gave, that composite score of 4.18, that was from the last employee engagement survey. And so, as Chrissy mentioned, we're currently in the process of completing another one, and we'll be looking very closely at those numbers. Any additional questions? I'll pass it back to you, Aaron, for fiscal resilience.
All right. So for our last couple of sections here, I think we talked earlier about a lot of the federal policy changes. Certainly, while a lot of those coverage changes don't go into effect until January 1st of 2027, one thing I would call out is on the health plan side, we are starting to see the behavior changes from this national conversation really now and really in the second half of 2025. So we saw big increases in utilization for our ACA populations and for our immigrant populations. We've been doing a lot of sort of underlying look at that. I think there's been different concerns over time, especially with our immigrant populations that we serve, about potentially not going to see their physician because of fear of the ICE enforcement. And we've really seen, when we look at the data, a stratification of what's happening within that population. So sort of there's a big drop off in individuals going to lower kind of acuity services, so going to see their PCP. But then when we look at sort of claims between $1,000 and $10,000 or $1,000 and $25,000, there's this big surge. So likely, and this is all conjecture sort of on my part, but likely what we're seeing is individuals that have an acute need are afraid of losing their coverage, and there's sort of the surge that's happening right now in utilization to get those issues taken care of before they lose coverage. And then on the flip side, there's sort of this pare down in activity for just preventive medical needs. So obviously that's a concerning aspect. From the financial side, that's also causing strain for us as a health plan because we're seeing that surge in expenses, especially in the second half of 2025. So I just want to lay that groundwork as I talk about this next section, because we know also challenging times are ahead as we head into 2027 as a broader health system as well. So our goal is really to move the plan to being sort of consistently stable, profitable health plan over the next 1 to 2 years. And that's really, framing from a couple different perspectives. One is ensuring that we are sustainable just as a health plan. But the second aspect of that is ensuring that we are in a position to support the broader health system as we move forward. And you can go one more slide. We know in 2027 that there's going to be this decrease in Medicaid eligibility and coverage, and the health system is then going to be serving a greater proportion of uninsured. And so we really want to position the health plan over this next 12 months to be a tailwind for the broader health system from a financial perspective, and ensure that we're able to kind of be an area of support, and not vice versa, where we're potentially a challenging financial position for the health system to also have to deal with. Certainly that surge in expenses we saw in 2025 and is carrying forward into the first half of 2026 been putting us in a deficit position. So we're now responding to that. We've sort of laid out a plan to try to drive about $100 million of cost savings over this next year to really, again, reposition the plan to be in a strong position as we head into 2027. So there's a variety of ways we're looking to do that. Some of that is just kind of fundamental things in terms of being able to renegotiate certain contracts, kind of relook at contracts that maybe we've seen lower performance on to exit. There are opportunities to enhance our care management activities for our highest cost members and ensure we're really getting them connected and lowering unnecessary utilization there. There's all kinds of things on our pharmacy side to do things like renegotiate our pharmacy rates with our PBM.
Are you guys weighing in on the 340B plan? Because I know that could really be at risk for.
From our side, on the health plan side, that should not have as much of an impact on us, but it will definitely challenge the provider side. So there's a series of things that we're working through there, and we'll continue to update this group on. We're going to do a deeper dive on a lot of the financial components in the finance committee, but just wanted to provide this broad overview here for you all in the managed care committee, that this is an active work that we're doing. And then finally, on the growth and transformation bucket, our overall objective is to move the market share up to 37%.
Another stretch goal?
Yeah. If you want to go forward actually 2 slides, I think. There we go. Yes, another stretch goal. Like I said, we're at that 35%. I think we continue to see opportunities to separate ourselves from a member experience perspective from the other plans, and that is going to be driven by quality, by member experience, by access, by ways we can support members during this time that's very challenged with redetermination. And I think we're seeing some of the results of our efforts over the past couple of years, and it's just sort of continuing a lot of that momentum as we'll move forward. And then next is HR1, which we talked a bit about. We just wanted to lay out here the variety of levers. Deb, if you want to go to the final slide. In terms of all the different areas that are going to impact how we respond to HR1. We talked about this before, so I won't kind of repeat everything on the slide, but I just wanted to give you a framework of sort of all the different pieces and all the different components that'll go into that planning. And I think, HR1 is going to be very challenging. I think it's also an area that we have an opportunity to separate ourselves in terms of the way we support our members versus the other MCOs, similar to what we were able to do with redetermination previously. So with that, that concludes our presentation, and happy to answer any additional questions.
Wonderful. Wonderful report. Yeah. Any directors have any other questions or comments?
Can you clarify, there seems to be a county care team that deals with redetermination versus like Marcelino and the CCH team. Can you just clarify how those operate and how you all might work together as well?
Yeah, so we work very closely with the Cook County Health outreach team. Okay. We do have our own outreach team as well that hosts all of these redetermination events, and built that kind of as Medicaid was unwinding at the end of the public health emergency. But we make sure that there's a lot of communication and connection with all of our different member touch points. So where there's opportunities for Cook County Health outreach team members to come and support and vice versa, there's a lot of collaboration there. Also with the Cook County Department of Public Health, we've been partnering very closely on vaccination events, redetermination and vaccination events on Saturdays through the whole kind of flu season. So wherever possible, we're working to ensure that kind of the 3 pillars of the organization have visibility and where we can leverage those events. Sure.
Any other questions, comments?
I just have one. During the community events, we have a lot of people that come out. Are we able to get them signed up again for insurance at those events? And do we have that data?
Yeah, so we have an average of about 50 people coming out every day to those events, and we can help people with new Medicaid applications, with redetermination. We also can help them with SNAP applications. At those events, we provide food boxes. So the first over 20 folks that come can bring a food box home. We also have care coordinators on site that help support them if they have any questions about their conditions or their health care. And then also if they have questions about rewards or any of our other benefits, it's just kind of a nice front door for our members. So we can definitely share more information if that would be helpful as we're talking about our strategy going into the new year around kind of how many applications we complete and that kind of thing, if that would be helpful. And then we have a really great partnership with the local DHS office so that if we have any escalations or support that's needed to be able to help people get through the enrollment process, we can do that as well. And we've partnered, so those events are held at our clinics throughout Cook County, but then we also partner very closely with our federally qualified health center partners as well to host those events. And we've been getting more requests for partnership on that as well.
And I would just add that the calendar is actually on our website, and so you can see that literally every day our events are occurring and where they're occurring.
And just one last question. So our patients that come in through county, the emergency room, and they're no longer eligible for insurance, but they were maybe 6 months prior, are we doing anything special for them to try to get them back on insurance?
Yeah, so in addition to the outreach events we have, Cook County Health has a team of application assisters that will assist people, especially those coming into the hospital, to reapply for Medicaid and re-up their eligibility. And then there's also a additional layer of if they don't qualify for any other program, then there's what we call CareLink, which is the uninsured program within CCH that they can also move into.
Thank you.
But your question is so timely because it's my understanding just over the last several months, we've seen our CCH patient base, the uninsured rate has gone from 13 to 22%. So this is a huge issue. And whether it's ultimately through CareLink or with our charity care, it's going to have an impact. So thank you for that. Any other questions, comments?
Thank you.
Okay. So with that, our next managed care committee meeting will be held on Friday, April 17th, and that will be at 10 a.m. And before we adjourn, all of you have a wonderful weekend. Enjoy the Super Bowl. And I want you to note that Lowry says Super Bowl 61 a year from now will feature the Chicago Bears. All right, so here for that. All right, Director Harrington moves adjournment, seconded by Director Staines. All in favor say aye. Aye. All opposed, we're adjourned. Thank you.
Thank you.
Year from now.